Hope all of you are having a terrific weekend. My name is Anant Madabushi. I am the director of New Jersey VT Seva, a branch here. And on a professional front, I work for a pharmaceutical company called Insight. And I work as a director for product strategy in oncology. I've been in the field of cancer for the last 15 years, and it's very near and dear to my heart. On a family front, I am blessed with a wonderful wife as well as two kids. Today, Anjani ji will be co-hosting with me, so I'll let her introduce herself.
Good morning,
Welcome.
everyone. I'm Anjani Katkanini, and I'm the director of Nojelsi branch. I'm a homemaker and a proud mother of a college-going kid, and I've been involved with VT Seva since 2013. Welcome to the third session of Meeting the Beneficiary series. In the last two sessions, we learned about our work in India and had a chance to listen to Netra Vidyalaya and Tribal School alumni. In this session, we're going to focus on the work and accomplishments of VT Seva in USA. Today, we'll be talking to few of our beneficiaries and donors who are going to inspire us and like few house rules. Basically, we would appreciate if you could mute your audio. And if you have any questions, please put them in the chat window. Thank you.
Thank you so much, Anjani ji. Again, as Anjani ji mentioned, if you have any questions, you can raise your hand or put your question in the chat window. We'll be monitoring that throughout the conversation here, as well as please mute your line so we get an opportunity to listen to the donors as well as the beneficiaries. So with that, I just want to remind everyone about VT Seva, what we focus on. For those who have attended the prior two calls, you must be familiar. But these are the four pillars that we focus on. Number one, we we try to educate and we educate uh, we educate visually challenged kids as well as underprivileged kids to make them self-sufficient. We also do a lot of cancer screening and cancer awareness work across US as well as in India. And the third piece is around protecting Mother Earth, and that's implied in the environment focus. And then finally, disaster relief. We do a lot of relief efforts when disaster strikes, and we're going to go through in detail in all of these. So I'll take a little bit time to spend. I'll take some time on this slide because this summarizes the impact of VT Seva. Since its inception from 2008, we have grown into 26 different centers across US, and that includes 3,500 volunteers. And out of those, 2,000 are youth volunteers, and almost 25% of them were awarded the Presidential Service Award, which is very difficult to get. So we are extremely proud of our youth volunteers. 500 of them were awarded these presidential awards. And as an organization, we have raised more than $6.5 million and donated that amount across the world, and also raised more than 1 million pounds of food to be distributed across multiple different food banks in US. Earlier we talked about the 3,500 volunteers, right? Put together, they have put in more than 300,000 hours, volunteer hours. If you think of that, that's almost 850 years. So that's, we're extremely proud of that, and that's a significant impact. One other number I want to bring your attention to is the one on the bottom right-hand corner, is the 4.5%. VT Seva is purely driven by volunteers. Nobody gets paid here. We try to put every single penny we get to all the four branches that we just talked about, the four pillars, all our efforts towards that four pillars. And there is some administrative cost, right? We can't escape from that. And if you think about, the technology, support that we need for to run our website, as well as if you think about um, the, uh, the money we have to pay for PayPal and so forth. So um, one thing again we are extremely proud of is that low administrative cost, and trying to make sure everything that we get is actually going towards the people in need. So here you can see our efforts in action. A lot of pictures here, again touching on all those four pillars that we talked about earlier. And again, since 2008, we have done lots and lots of work. So let's start with coronavirus, right? That's the biggest thing that's happening right now, the biggest crisis we are facing as a, I mean, humankind. I mean, not just here in US, right? All across the world. If you think about it, just in US, 10 million people have been contracted with the virus, and 237 folks have lost their life. That's extremely unfortunate, and 20 million people have lost their jobs. The other impact was the number of households that are going hungry have doubled, and this impacted more so the houses with children, and that's very unfortunate. And on a personal front, I lost a 41-year-old cousin of mine for due to COVID. Again, um, a lot of grief that a lot of families are facing, and VT Seva stepped up big time during this COVID situation, and we've done a lot of different things here. Number one, 17,095 masks and PPEs were donated to frontline healthcare professionals. And then our volunteers were extremely busy in terms of stitching the cloth masks, and those were given to homeless shelters, rehab centers, as well as senior centers. And what we are proud of is the young volunteers who have spent thousands of hours fundraising, doing bake sales, walkathons, and we'll talk a little bit more soon. But they have done a commendable job during this COVID time. And all that led to us raising more than $115,000 that was donated to food banks across the US. So if you think of the breadth and depth of our organization's impact, you can see here more than 33 cities were involved in this effort, right? So there was homegrown and just enthusiasm to do more during this time. I actually felt like we actually were more active during COVID time than we were before, and people just stepped up. Even with doing everything remotely, people have really stepped up and donated, did fundraising, and part of that is also donating 100,000 plus meals for migrant laborers in India who had very tough time during this COVID situation. If you could please mute. Um, so on behalf of VT Seva, we want to thank every frontline hero. Again, from the bottom of our hearts, we thank you for putting your lives at risk and helping others during this time. We are super fortunate to have Dr. Santoshi, who is one of the frontline hero, join us today. She is, I had a chance to talk to her over the last 1 week and got to know her a little bit. And I was truly, truly impressed on the patient focus he has and all the things she has done. But let's find out more. Dr. Santoshi, are you on the line?
Yes. Hi. Good morning, everyone. This is Dr. Chakilam. My first name is Santosh. Yes.
Okay, I apologize. So, Dr. Chakilam, thank you so much for joining us today. Again, we truly appreciate taking time off from your busy schedule to join us. So first, let me start with asking you, can you talk a little bit about your hospital, the role you play there, as well as the area you serve? Dr.
Yeah,
Chakilam?
sure. Of course, I'm not part of Jersey. and I'm a hospitalist. I work for Atlantic Group. Maybe most of you guys have known. There are multiple hospitals under Atlantic Group, Morristown, Overlook, Newton. There are multiple. So I work most of the hospitals. I actually take care of intensive care unit patients, CCU, which is cardiology critical care unit, and also inpatients, any general inpatients. So it's mainly like who are very sick, we take care
Mhm.
in the hospital. That's what my role is.
Okay, no, thank you for that. I'm pretty sure you have seen a lot of COVID patients during this time, I would assume.
Yeah,
Yeah,
I can say
unfortunately.
a lot.
Yeah. So, as we see TV every day, right? Doesn't matter what channel we put on, we're just
Mhm.
becoming numb to the numbers. Unfortunately, just you know, not just the numbers, even the images. But people don't understand the gravity of the situation. One story that comes to my mind is the Andover nursing home that unfortunately made some national news. So, if you could talk a little bit more about that case, as well as the relationship your hospital has with that nursing home and what you were able to do.
Yeah, sure. So Andover Nursing Home is one of the largest nursing homes in Jersey. It's more
Mhm,
than 500 beds,
mhm,
actually.
mhm,
It's both psychiatric and regular nursing home together.
mhm,
But unfortunate thing is, of course, COVID has hit all the nursing homes. But since this is the biggest one, we had so much of COVID going on in the nursing home. But the main thing is the unfortunate thing which happened during at that time. Every one of us know that there is a issue with the morgue to keep the bodies, dead bodies. It's
mhm,
which I really don't want to say as a dead bodies. It's a
mhm,
respect to all the person.
mhm,
But they found there was a call to the local uh, police station because
mhm,
they were having some intense smell coming from the nursing home, and they found like 17 bodies, dead bodies piled up in the garage and also in the morgue together.
mhm,
But the unfortunate thing, we are the closest hospital. We treat those patients when they are alive. I
mhm.
really stutter even when saying this because nursing home patients, we all know they already go through a lot, but
Yeah,
death is something which should be respectful, but they
yeah,
did not had that chance.
yeah.
So they found 17 bodies because there is no place and no way to put them. At last, they
Mhm,
brought all the bodies to our hospital
mhm.
and they stored in our hospital.
Yeah.
But personally, the main thing is we are connected because we treat these patients over years. They're
Mhm.
part of us.
Yeah.
And it's very sad we lost so many. Actually, there were total of, I think, more than 150 positive patients, including nurses, doctors, everyone. And actually, the 17 bodies which they found, there are a couple of nurses,
Uh,
which was really, really sad.
yeah. No, I mean, I can only imagine. Actually, I'm getting goosebumps right now. Just and just thinking of it. And you have personal relationship with some of these, and knowing that some of them included nurses, and I'm sure they knew going in that they're putting their own lives at risk. So it's just again, we can't thank you enough for the and that's exactly why we call you heroes, because to do something like that is just truly amazing, and a very unfortunate situation here.
Yeah.
So I know a lot of organizations have chipped in, and they're doing their part to raise awareness. I know VT Seva donated several masks to your hospital, as well as you have relationship with VT Seva in prior years as well. So if you could talk a little bit more about what VT Seva did, but more importantly, what's the role of organizations like us in raising awareness around COVID?
So I'm first of all, let me thank you, VT Seva, for and letting me be the part of this. Because at the time of mainly at the time of COVID, I know we did so many other things, but at the
Mhm.
time of COVID, the crisis is really bad.
Yeah.
So the the main thing is with the mask.
Mm.
And we really, you understand, like without mask, we cannot see the patient.
Right.
And the mask is the crisis at that time.
Mm.
And VT Seva, me and Anjani Garu actually talked about it. I said, we really need the mask. But
Mm.
it did not take much time to raise the money and get
Mm.
the mask right away.
Mm.
Trust me, I got so many emails from the higher authorities in Atlantic
Mhm.
thanking for that, because we tried many ways to get the mask and
Mm.
the PPEs. Every
Okay.
little thing helps in the time of crisis,
Right.
but VT Seva made a lot of difference. I really thank you, all of you, whoever is here and a part
Mhm.
of VT Seva, for doing this. I don't know, like at your homes, it may be different, but in the hospital, it's
Yeah.
a like 1,000 time difference for us,
Yeah.
because we are able to save a person, a
Mhm.
patient is a big deal for us. That's the only job we do.
Right. No,
So
again, I can't, again, thank you enough as well from our side. We did our part. Again, I'm sure it's a drop in the bucket when you think about the overall efforts, but we appreciate your comments here. I know there's a lot of unease and gloom, when people just look at it every day, just, the numbers keep climbing. And I believe we are at the peak now, more than, close to 1,000 deaths every day, 75,000 new cases every day. I want to also find out, I'm sure, there are positive and uplifting stories as well,
yes.
without, giving out any patient details, obviously for HIPAA regulations. If you could talk a little bit about, any uplifting stories, because I do want to end this on a positive note, at least, our conversation here.
Yes.
Any stories that you can share with the team here?
Oh, I can say as many as you want, but let me tell you a couple of them at least,
Okay,
which
sure.
really touched my heart.
Mm-hmm.
Uh, there is this patient, like there is a family who had a get together at the time of the COVID.
Mm-hmm.
The whole family, it's some festival, I don't even remember at this time, but they had a get together. The whole family got the COVID, but none of them know that everyone is in the hospital at that time, because everyone was intubated.
Mm-hmm.
There are most of the death already happened by the time they came to the hospital,
Mm-hmm.
but the father was only one who was paid. In our hospital there were three daughters and the mother with the
Mm-hmm.
son, with the father was the only person who is outside. Mother already passed away.
Right.
The sisters, both of them got intubated. The youngest of the one was the only one. She was also intubated. She was on the vent, but she came out of it,
Mm-hmm.
which she has no idea what's happening in the hospital at that time. She doesn't know her mother passed away. Her sisters are intubated. Most of the family already passed away.
Mm-hmm.
She was in a regular floor. I was the physician who was taking care of her. She
Mm-hmm.
consistently asked me to call her mom,
Mm-hmm.
which I was not able to do. And her father cannot come inside to tell her,
Right.
because of the COVID. There are no visitors. She
Mm-hmm.
needs emotionally someone to tell her emotionally, but there is no one. And as a physician, I'm not able to do that.
Mm-hmm.
Everyone of in the hospital know about this, because we were trying to keep her off asking her mom. She's a
Mm-hmm.
big lady, like she's 40,
Right.
but she's not like very old too. So of
Mm-hmm.
course she's concerned about, like, why no one is calling me, why no one cares about me. But we
Right.
cannot say that to her, because her
Yeah.
father was, he knows if he calls she'll ask the same question and he cannot answer.
Mm-hmm.
So we did our best, but of course it's a news we have to give her.
Mm-hmm.
But I was not the person who was able to do it.
Right. Again, I'm glad she, she was okay, but again, we talk about numbers, but there is stories behind each of those numbers, and there is, very touching. So thank you for sharing that. I know there's a lot of folks on the call. Is there any final advice for us on how do we deal with this? And I know the standard things we need to do, right? Wear masks, socially distance, as well as washing hands frequently. Is there anything else we should be doing?
No, I think what they're like everyone knows about it now. Wash your
Mhm,
hands, put your mask,
mhm,
try not to gather more than 25 people at any time. I really don't advise that too. But of
mhm,
course, we all need a social get togethers, but try
mhm.
to avoid that too.
Right.
The good news is, whichever the second wave we are going through looks
Mhm.
like it's not so bad as the first wave. We are
Okay.
not having that much mortality.
Mhm.
And I'm really praying to God we keep that way.
Yeah.
I'm
No,
really praying.
I'm pretty sure we will defeat this pandemic. It's about time, and I know all the companies are looking into the trials, and in addition to all the vaccines and so forth, we continue to do what you just laid out. So again, we truly, truly, truly appreciate you coming on the call, taking time away on this on Sunday morning. So we appreciate, and for everything you do for your patients, as well as everything you have done here to educate us more about COVID and what we need to continue to do. So thank you so much, Dr. Chakilam. Have a nice
Thank
day.
you. You too. For one thing, guys,
Sure.
there is a very good positive outcome. Even though my story didn't say that, there are
Mm-hmm.
so many patients we discharged who
Mm-hmm.
left hospital cheerful and
Mm.
happy. So there
Yeah.
is always a hope for this, but
Yeah.
just be careful.
Yeah.
Okay.
No,
Thank you
that's
very
good.
much.
Thank you so much. Again, it was good to listen from you. So we appreciate that.
Yeah. Have a good day, everyone. Bye.
Bye. So that was again Dr. Chakilam, one of our frontline hero. Now we'll turn to Anjani ji to talk about how VT Seva. Earlier, I talked about how we were super active during this time. So she'll walk us through some of the things we did during COVID time. Anjani
Thank you,
ji.
Ananji. Yeah. As Ananji just spoke, our lives completely changed when COVID hit us, and we at VT Seva were not able to do our regular live events. But instead of complaining, our team sprang into action, and our youth came up with many unique ideas to engage the community during these times. So, not only ideas, but they were able to execute these to perfection. Uh, and then we did a lot of virtual events during summertime, virtual runs virtual runs and walkathons, and musical evenings, public speaking contests, poster presentations, programming classes, high school camps, financial literacy classes, and many, many more. It was very inspiring for us to see our youth step into action and take it on themselves to help the underprivileged. Okay. Now, let's take a minute to focus on VT Seva services towards our food banks. Let me ask you a question. Do you know how many million people in US depend on food banks and meal service programs? If you guessed a number less than 10, you'll be surprised to know that there are 46 million people who depend on food banks, out of which 16 million are kids. Imagine yourself in their shoes. Think of those kids who do not know when and where their next meal is coming from. It's impossible for them to get out of the vicious cycle of poverty and take steps towards self sufficiency if, if they're always hungry and worried about food. As philosopher Simon Wells said, feeding the hungry when you have the resources to do so is the most basic of all human obligations. In our efforts to fight against hunger, several hundred volunteers across the nation uh, have, they have raised, they've conducted food banks. We conduct like food banks periodically and donate at local food banks. So, and we are proud to say we are one of the significant contributors at local food banks. For example, in New Jersey branch alone, we donated up to 10,000 pounds till now. And since its inception, VT Seva has packed or donated around 1 million pounds of food. Apart from this, our volunteers spend thousands of volunteering hours at food banks. Our youth volunteers are out there volunteering every weekend, sorting food, or wrapping up burritos, or making breakfast bags, or preparing lunches at soup kitchens. And
Yeah, thank you, Anjani ji. Now that was again a good summary of some of the work that we do at food banks. And earlier we talked to one of the frontline heroes, right? And in my mind, there are a lot of other frontline heroes, and the people that work at food banks are also frontline heroes. So we are super fortunate to have Ali O'Brien. She is, like I said, one of the frontline hero that works at the food bank in Somerset, New Jersey, and she is part of the Franklin Food Bank. So, Ali, are you on the call?
Yes, I'm here.
Hey,
hi.
Ali, how are you?
Hi, how are you?
I'm doing good. No, thank you so much for joining us. So, Anjani ji and I will ask you a few questions. So, Anjani ji.
Yeah, welcome, Ali, to the VT Seva National Call. First, let me tell you how inspired we are, with the work you do to underprivileged and those people who are really in need. Uh, we would like to know a little bit about your food bank and the community you serve, and what do you think would happen if there was no food bank in your area?
Yeah, like Anant said, I work at the Franklin Food Bank. It's based in Somerset County, New Jersey, and we serve thousands of families on a monthly basis. So the Franklin Food Bank was established in 1975 and has been continuously serving families since then. It's been growing a lot over the past 45 years, but nothing like this year. We've seen the need increase exponentially very, very quickly. And so typically, like in 2018, for example, we were serving food packages. That was sort of our program model, where families would come once a month and get very large amounts of food that would sustain them for ideally for the whole month. And then 3 additional packages per year, so up to 15 visits per year. And then in 2019, we changed our program over to a client choice method, where families would come and shop at the food bank, and it was more like a grocery store. And through that program, we grew a lot because it was very popular. It was a very popular way of sort of distributing emergency food assistance to the community, because people got to choose whatever they wanted and needed and whatever they were familiar with and could cook for their families. And then in 2020, we all know that COVID happened. And so we had to switch back to our previous program model, where families were getting up to between 200 and 300 pounds of food per visit, and our clients are able to come twice a month for food. And in 2019, we would see around 850 families on a monthly basis. That would be sort of a little above the average, but that was what we were seeing towards the later part of the year when the program was picking up. And then in 2020, our running total is 1,158 families every month that need food. In May, we served 2,100 families. So to answer your question, what would happen if there was no food bank in our area, is that families would not have adequate assistance with emergency food. The Franklin Food Bank is the only comprehensive food assistance program in the area, and we serve some of the poorest parts of Somerset County, which is around Franklin Township and that area.
Yeah, that's a huge number of families, 2,000 family per.
Yeah. So Ali, again, I totally agree with you. When it's one of the few food banks where I've seen people come in with carts and actually have access to fresh food that was a surprising difference as well, because most of the places, you kind of see canned foods and that kind of thing. Your place was completely different and unique, and again, whatever we see on TV, huge lines, miles and miles of lines of cars lined up, and I'm pretty sure, with just the numbers you quoted, it's just, more than double the need. So, it's like the supply and demand, right? So the supply is not keeping up and is probably lower than what you typically get. So no,
Yeah.
thanks for sharing that. So
Ali,
Anjani, sorry, go
I
ahead.
have one. Yeah, I have one more question. Like, I'm sure you must have made like some personal friendships with people who come regularly to your food bank. So, do you have any personal story where you saw a major impact of your work that totally changed someone's life?
Yeah, I think I think in part you've sort of described everyone who comes to the food bank, because
Mhm.
one of our main goals is by providing food assistance to families, they're able to use their limited income for other things, like not just paying the rent and paying utilities, but also pursuing long-term goals like education and health goals like having access to their medication, being able to buy their medication with the money that they save from our assistance with food.
Mhm.
And then I could share one nice story that I'm glad I explained client choice, because um, we had a father who's a single father who was a client. He came in, multiple times per month to get food, and his son has an allergy to food dye, which is like
Mhm.
kind of an atypical, sort of you don't see that allergy very often. That's something that a parent recognizes causes behavioral issues with his son. And he was so happy that he was able to come to the food bank and shop the way that our program was designed at the time, because he was able to read labels and he was able to spend time, making sure that he had access to the foods that
Right.
were right for his family. And like it was mentioned, we love our farmers, we love our partners. We work with Grow a Row, we work with Feeding America and Farmers Against Hunger, so that we have as much fresh produce and fresh foods as possible. We've spent the past 40 years making close relationships with our vendors in the area so that we are able to offer clients and families in need not just food, but good food.
Mhm.
And so that, that person, that client is a really special story to us, because it really outlines why we do what we do. And the difference that it makes in his life is that his son doesn't have to have behavioral issues just because they are on a limited income. And he actually was injured in a terrible car accident and lost his job, and that's one of the reasons why he ended up at the food bank. And so to then still be able to maintain the level of
Yeah,
food quality in his house was really special.
yeah, that's great.
We
Like,
are hoping to be able to get back there.
that's wonderful to know that the child was able to have a healthy life because of you. Other question I have is like your supervisors have seen a lot of our VT Seva youth volunteers in action at your food bank. So I heard one of your supervisor had praised our kids about how efficient and dedicated they are. So can you tell us a little bit about how these youth volunteers were different?
Yeah, so VT Seva is one of the few organizations that we work with that has sort of a national presence. And so working with a national volunteer organization allows volunteers to not just make an impact on the Franklin Food Bank, but to make an impact on the whole country. And the work that we do is not dissimilar from the work that's done, as you know, with food banks across the nation. And so um, not only is it great because of the level of impact, but it's great because working with an organization that has this national presence, all you do is volunteer. So it's very efficient, it's very organized, it's very, everyone's very engaged in what they're doing and very happy about what they're doing. Not that our volunteers aren't typically happy, but it's just kind of a different ball game. It's like the difference between working with a bunch of like Boy Scout Cubs and working with a bunch of Eagle Scouts. that's kind of like the analogy that I can, I hope everyone gets that analogy.
Yeah,
Thank you so much.
it does. It
I
does
really
make
appreciate
sense.
your comment. Yeah. So yeah, thank you, Ali.
You're welcome. Thank you.
So Ali, thank you so much again. I know it's a Sunday afternoon, and you took time away from your busy schedule to be on the call here. We truly appreciate. And one thing we can promise from our side is, we will continue to engage food banks, not just yours. We'll be there as soon as it's open and continue to donate. But our promise to you is, as a national organization, our volunteers and our efforts will continue to be there to support all the food banks across the nation. So we appreciate you coming on board, and thank you, and have a great weekend. Thanks,
Thank you
Ali.
so much. Thanks for having me.
No, thanks.
Like at this point, I would like to thank all the donors, volunteers, and sponsors of VT Seva for your volunteering, generosity, and support. We're able to do all this with your support.
No, thank you, Anjani ji. So last week or last two calls, we focused on the education pillar and laid out exactly our impact and efforts in educating 2,300 visually challenged kids, since our inception, as well as 10,000 underprivileged kids from tribal areas. So you have seen the impact. You had a chance to talk to several of them in the last two calls. This time around, we're going to focus on our efforts in this area, what we do here in US, and we do volunteer as well as support Tennessee School for Blind, as well as the Houston Council of the Blind. And if you think about it, the focus of both these organizations is again self-reliance, right? So how do we make sure these kids become self-reliant and lead an independent life? And that kind of motto aligns with what both the Tennessee School and the Houston Council does. And I'm always reminded of my, can you please mute? Sorry, if whoever is, can you please mute? Thank you. So one of the conversation that I had, I keep going back to this, and we as VT Seva, why we are involved in this. So why we are involved in this? This is a small story from my interactions in Hyderabad, the Netra Vidyalaya visually challenged school there. I was just having a casual conversation with one of the kid, and I was asking him what he wants to do, and he was saying he wanted to be a chartered accountant. And then the next subsequent question was, okay, what do you need? And he was saying, what I need is the support and encouragement from you. What I don't need is sympathy, right? So again, that kind of reply shocked me. And he said, like, I am ready to put in the effort. I am ready to do what I'm supposed to do, as long as I have the support and encouragement. So I just request all of you here on the call, he's ready to put in the effort. So we need to ask ourselves, are we ready to put in the effort? And I know a lot of you have stepped up and did, but there is, there's more need as well, right? So so with that, let's actually meet with a couple of amazing people, Peggy and Michael Garrett from the Houston Council of the Blind. They've been supporting the visually challenged since 40 years. I welcome them to the call. Peggy and Michael, are you on the call?
Yes, we are. Good morning, everyone.
Good morning. Thank you so much. I hope your weekend is going great and you're doing well.
It is going great. Thank you so much. And thank you for inviting us. And I have to tell you, Raj, that I'm having some computer issues and I cannot get my screen reader to stop talking. So
No,
there
that's
may
okay.
be some slight interruptions. I'll do my best to keep it from talking, though.
No, that's okay. We totally understand and appreciate that. So Can you just talk a little bit about what Houston Council of the Blind organization is focused on, and what do you do, and educate some of our listeners?
Yes, Michael's going to talk about that.
Good morning, everybody.
Good morning.
Yes, yes. Again, thank you, Raj, and thanks VT Seva for coming in and collaborating with us. The Houston Council of the Blind is basically uh, an advocacy organization, a support group, so to speak. And our mission and our aim is, as Raj said earlier, is to seek for the independence and self-reliance
Mhm.
for people who are blind or visually impaired. So we try to look at all of the issues that surround each of us,
Mhm.
whether it is education, whether it's housing, whether
Mhm.
it is employment, all of those, or transportation, which is one of our biggest issues, because as a blind person,
Right.
they won't let us drive. I wonder why. But anyway, uh, all of those key areas, all of the areas that anyone who wants to live independently needs, those are the areas we try to help people gain some independence and self-confidence. So
Mhm.
our meetings are generally upbeat. We try to encourage our members to share information, to provide all of the services that they need. One of the things I like to think about, I thought about this morning, one of the issues that when Peggy and I do a presentation, we always ask our sighted audience, if you could choose to have a disability, which one would it be? And nobody chooses blindness,
Mhm.
because being blind is very different than most other disabilities, because so many accommodations have to be made. You miss out on a lot of things that are primarily visual, but we still want to live productive and contributing lives in our society. So that's what we try to do, is providing alternatives, or any way that we may have to do things, but we may have to do them differently. But that's what we try to get all of our members to do.
Michael, I mean, no one ever actually asked. I'm sure a lot of the folks on the call agree that question around. Again, we don't. God bless everybody. Nobody should have anything, but when you put it that way on the importance of the site, and more importantly, the uplifting message and the uplifting work that you guys are doing is just truly inspirational. And we're just it's amazing. So thank you for sharing that. So in terms of VT Seva's role, and what they help you and your team, can you share a little bit about what the VT Seva team does with your team?
So Peggy's going to do that.
Okay.
So yes, VT Saber has been working with us for about 2 years now, and let me say just upfront how much we really appreciate you guys and your volunteer services. We have monthly meetings, usually on the first Sunday of the month,
Mhm.
and volunteers have come and assisted us by donating uh, snacks, being there just to assist people to get in and out, just in so many different ways, that because we are blind or low vision, that we need that kind of assistance. In addition to that, last year, you guys donated two $1,000 scholarships to our students. And that was just wonderful, because we have always have students who are struggling with school. Some of
Mhm.
them are having to work as well as trying to go to school full time, and that just made such a huge difference. uh, that donation to them. We just, as Michael was saying, being blind makes such a big difference. Even something as simple as arriving at the location, trying to get into the building, find a seat, or when the meeting is over, get up, get back out, get to their vehicle, know which vehicle to go to. uh, you all have been just so great with us in all of those areas, and we really appreciate what you do. This year's been different
Yeah.
because we haven't been able to get together because of the pandemic. So, but we're looking forward to when all of this is clear. And
Mhm.
we do have some other projects coming up between now and then that we'll be letting you all know about if you're interested in participating in those as well.
No, Peggy, thank you for sharing that again. It's a lot of little things we take it for granted, and we appreciate your comments that the team was helpful. Again, we will continue to work with you, and we look forward to more opportunities to working with you and your team. So thank you so much for joining us today. We appreciate your time here, and I'm sure a lot of the folks that are listening in are truly inspired, not only with your actions, but also what you informed us. So thank you.
But thank you all very much as well.
Thank you.
Thanks, Michael. Bye,
Okay.
Peggy.
Bye bye.
Bye-bye.
Take care. Everybody stay safe and blessed.
Yep, you too. So again, folks, if you have any doubts on what you do and why you do, I mean, hope you're seeing all the things that not just you might be thinking, okay, locally we're doing this, but again, from a national perspective, think about the kind of impact that VT Seva is having and what more you can do, right? So please do continue to be engaged and do more. With that, I will turn it over to Anjani ji to talk about importance of volunteering. Anjani ji.
Thank you, Anandji. Yeah, I'm super excited to introduce Mr. Giri Amaravadi, who is a professor at University of Texas at Arlington. Mr. Amaravadi places a high value on volunteerism, and he's done an amazing job of inspiring 150 youth volunteers to volunteer with VT Seva. One of the challenges we have at Netra Vidyalaya is to teach science to our students. And we are working towards bringing science and technology into Netra institutes with the help of Mr. Amaravadi and his students. We are extremely grateful to Professor Amaravadi and his students for his efforts. Let's find out a little more from him. Mr. Amaravadi, are you on the call?
Yes, Anjali, thank you for having me here.
Thank you. Welcome to the call. And we would like to know, why is volunteering important to students at Arlington University, Texas Arlington University?
Absolutely. I mean, I think we are all highly educated on this call. One thing our educational system is teaching is how to complete a course. By the time you complete college, you take more than 60 or 70 courses in a cookie cutter mode. You know how to take quiz, assignment, and exam.
Mhm.
One thing I learned in my life is I never learned what real world is, what empathy and civility means. It's not my idea, absolutely not. God blessed me to run into individuals that influenced me to have that idea. So the reason we do this in UTA is I teach around 300 kids a year. An exam grade a project that is related to empathy and civility we work on. We pick different causes, and one of the causes, fortunately, I ran into Funny and Krishna. They inspired me to talk to some of the kids in Netra Vidyalaya, and we started helping. To answer your question, why we need to get our youth to do that and our college kids to do that is very simple. Um, I mean, I heard happiness when Michael mentioned when you help somebody. If you find that you show empathy, you help others, you feel some void or purpose, that's addictive. So if you put that seed in one student and help him influence others, we don't just inspire few people, we inspire a generation. Hopefully one of these students is successful, that's worth it. That's the reason we do that.
Very well said. Yeah, I think that's why most of the volunteers at VT Seva do the volunteering too. And so I would like to ask like one more question as to What's the latest update? I know in the morning you had a call with the students at Netra Vidyalaya. So what's the latest update regarding what you did with your students?
Absolutely. I mean, we had a call with students in Hyderabad Netra Vidyalaya, and what we want to do is for this fall, we want to connect and understand what they need in short-term basis. We recognized because of the COVID, just like everyone, they are impacted too. They don't have classes, whatnot. So we're trying to see how we can record few things in audio and share with them. And in the long term, I want to learn from this group here, for example, Houston Council and others, to see how we can collaborate with modern universities and figure out the better way to teach them science and other technologies to get them into successful fields. That's what we are working on. But if I need to summarize the call in one word, um, we felt inspired. We thought we are helping them. Absolutely not. They are helping us because the, the the happiness and the strength and hope they shown is really something we could use more than they do. So it's inspiring for my class too, after having the conversation with them.
Yeah.
No,
Thank you.
that's amazing, Professor. Again, earlier we're talking about, what they don't need is sympathy. What they need is our support and encouragement. And you're absolutely right. We learn more from them than, just their perseverance and just the hard work they put in and the effort they put in. It's just truly inspiring and amazing.
Actually, well, like when I first met them in 2013, that's what when I met them, that's what I was very impressed with their like positivity, hope, and looking at them, I'm like, if they can have their, you know, oh, sorry, 1 minute. Sorry. Yeah. Then wow, but like, people with everything, they're like feeling depressed and all, and with such a big disability, they're like so hopeful to fight against everything and come successful. We have seen many examples of them being very successful. Thank
Yep.
you. And do you have any other like message to our volunteers?
I mean, one thing I want to say is that thank you, VT Seva and Krishna and Funny. Ali mentioned we are a national organization, but I realized last night VT Seva is an international organization. You're reaching everyone across the globe, not just in here. The message to youth here is very simple. You're the future. And I mean, I came to this country with $300 in my pocket. That making money did not make me happy. Getting to higher positions in hierarchy in corporate world did not make me happy. And what really truly made me happy is knowing myself, not artificial intelligence or machine learning. Knowing yourself, knowing what your passion is, what ticks your heart. I leave you with that word. What ticks your heart, you find it early, because the biggest asset is time. That's what Funny Aduri taught me. Thank you, guys. Thank you for giving me the opportunity.
Thank you very much for your time, Mr. Ramadi, and we can't wait to see the output from this partnership.
Yeah.
Appreciate your time.
Thank you so much, Professor. Again, you definitely ticked our hearts one more time, and we appreciate your time.
Let me see if I can get out of mine.
Anjani ji?
Yeah, let's take a few moments to look at our disaster relief efforts. The word says it all, like disaster. Can you imagine like your family members, family members being swept away in front of you, or your house being ripped apart with your family members in it? We shudder to think of such situations. And VT Seva is one of the first few organizations to respond to disasters around the world and provide immediate disaster relief. Like there are many places where we have good volunteer base, and if when disaster strikes in that area, our volunteers on the ground take charge of disaster relief efforts. And in few places where we don't, we collaborate with the local organizations to provide disaster relief to the victims.
But it's not.
In 2017, Texas and particular areas around Houston were badly hit with Hurricane Harvey, and it was one of the costly hurricanes to hit US. It caused $125 billion in damage and 68 deaths and around 38 indirect deaths. So VT Seva engaged more than 500 volunteers to serve continuous, like 20 continuous days of food supply, serving 20,000 meals, and cleaned 200 flood affected homes, distributed 100,000 water bottles, and provided immediate medical guidance. And VT Seva raised more than $50,000 to provide disaster relief towards Hurricane Harvey.
Thank you, Anjani ji. Again, like I said before, just don't think about the numbers itself, right? It's the stories behind. It could be simple things, especially when you're going through something like this, and somebody, that you probably don't even know comes and gives a lending hand. It makes an impact. It makes an impression, and there are stories behind each one of these numbers, right? So that's the important thing. So we are again fortunate to have the mayor of City of Rockport, Mayor Rios. Are you on the call, Mayor?
Yes, I am. I'm right here. Thank you.
Thank you so much again. Hope you're doing well, and hope your weekend was so good so far. And I just wanted to ask you, can you provide a little bit more detail around City of Rockport and your community, and specifically around how was the situation when Hurricane Harvey hit?
Sure. Hurricane Harvey was a hurricane and a storm, and you probably heard this before. Everyone is different.
Mm-hmm.
We were completely unprepared for this storm. We've tracked it for about 5 or 6 days prior to that landfall in our emergency operations center.
Mm-hmm.
And on Wednesday evening at 10 p.m., we were told that the storm would probably dissipate and be nowhere near us.
Wow.
Thursday morning at 10 o'clock in the morning, the situation changed. They predicted a direct hit upon us. So typically, when we're getting ready to call evacuation, we do that about 40 hours before anticipated landfall.
Mm-hmm.
By the time we were notified, we had 31 hours. So it was extremely difficult to get the word out and get everyone out of town.
Wow.
It hit us Friday evening on the 17th. It started coming in about 7 p.m. And we spent 11 and a half hours in hurricane force winds. The meteorologist here compared it to being in front of a fire hose for 11 and a half hours.
Wow.
It was wind-driven rain. We had wind speeds sustained of 132 miles an hour with gusts of up to 165. When we got out the next morning after the storm had passed us, the town was completely devastated. It was an amazing feeling to walk out. We live on the Live Oak Peninsula, which is covered with trees. There was not one leaf on any tree in the community. Trees were down everywhere. Power poles snapped, homes completely destroyed. Our first mission was search and rescue. We got out and we drove and walked through the areas. We had to clear trees out of the way so we could get vehicles on the road. And we were looking for survivors or people who had been hurt. We were extremely fortunate because we had no deaths associated directly with the storm that first day. But people, imagine finding people coming out of their homes when they'd hear the truck pull up, and they were like zombies. They had no idea what had happened to them.
Right.
They're just a complete devastation. This went on for about 3 days, but once we realized that we had no death, we took that as a sign of encouragement. But we knew we had a big job in front of us, and what we were fortunate with so many groups that volunteers that came out to help us. But at some point, a lot of the volunteers came and just dumped things on used clothes and things like that everywhere. So that was a difficult situation. But
right.
As things settled down, we got help from the state. We got help from neighboring communities, and an outpouring of volunteers that supplied us with basic needs, water and ice. It was extremely hot, no electricity for 15 days.
Wow.
But we managed to get through that, but it's part of the recovery process, I was working with city employees, and we were teamed up to a pair. We would drive around looking for people that needed help, and we're providing them water, ice, things like that, food if we had it. And it was amazing to see. At one point, we made a decision to go by the employees' homes and so they could check on their situation, because we had all moved into the excuse me, the Rockport Service Center. I was with 3 different people. We pulled up to where their home used to be, and everything was gone.
Wow.
And these employees just looked at me and said, "Well, I guess we'll have to start over, but let's get back to work."
Right.
They're extremely dedicated. We had over almost 30% of our workforce, city employees, lost everything. They lost their home, vehicles, clothing, had nothing to turn to. So they moved into the service center. They were living there. But as time went on, we found out that so many of the faith-based groups were out volunteering to help. And then the things that we found out we needed were manpower, material, and money.
Right.
Waiting for the bureaucracy in the federal government. They've been, I don't want to say they haven't been a big help, but we're still dealing with claims over 3 years after the storm with the government in the way of FEMA help and things like that.
Wow.
But these local organizations made cash available to us instantly. And our goal was to put that money directly into the citizens' hands that needed it, based on need. If they needed to buy food, if they needed to buy necessities for their family, children, diapers, things, medicine, things like that, we were able to give them cash or cards to help them through this process. It was an amazing outpouring of love and volunteer spirit from all over the United States. When I got a call from Dr. Rao with your organization, I didn't know who she was. I knew she was in San Antonio, but she spoke with such sincerity that it was amazing. And she did such a great job of organizing the fundraiser in San Antonio for us. I have to, excuse me 1 second. My granddaughter's over here and she's starting.
No, that's okay. Again, it's part of the the Zoom world we live in. So it's natural. So.
I think they call it a Zoom bomb, but
yeah, correct. But no, we actually like that, so we appreciate that. Yeah.
But my wife and I and some other folks, we went up to San Antonio to meet with Dr. Rao, and they had an amazing presentation. It was well organized. They had dancers, they had singers, and then I was able to speak to the group, and tell the story of Rockport and of our citizens.
Right.
It was an interesting situation because we were hit directly by Harvey. We're the first community hit. And if you remember, the storm moved on and lingered in Texas for many days, but then it flooded the Houston area completely. Right. Well, Houston being such a big community, a big city, more influence, more coverage, more media. Right. They forgot about us. We got kicked to the curb.
Right.
So when Dr. Rao again called, it was amazing to find out that people were still concerned and wanted to hear our story.
Right.
We gave a presentation to the group. They gave us a check for it. It was amazing, for $10,000, and I can't tell you how much that helped people that were on their last desperate need. And then while we were there, we collected an additional $1,100. So we got quite a bit of cash that was put right into the hands of the folks as soon as we got back to Rockport from San Antonio.
Right.
I believe.
Yeah, go ahead.
I believe that because it was well covered by the media, I think that event that y'all put together inspired other people to follow your lead and not wanting to be left out. They wanted to, you so inspired people by helping complete strangers.
Yeah.
It made other people feel that they had to do the same thing.
Right. Thank you, Mayor Rios. That was so inspiring. Again, we are so fortunate to have Dr. Mrudula Rao as part of our team, and appreciate her efforts. But based on what you just said, just having just 31-hour notice, which is like 1 day notice pretty much, and again, City of Rockport is also very fortunate to have a mayor like you that cares about them, and your story around your checking on your own employees as well is commendable as well. Again, we are so glad that again, when people think about 10,000, okay, it's not a big amount, or but the fact, like you were saying, if it inspires other people to do more, again, we'll continue to do our part. Thank you so much. Is there anything else you would like to um, convey to our group of volunteers and donors here?
Well, what I'd like to do is thank everyone for what they've done for us. And when Dr. Rao called me and asked me if I'd be willing to speak to you all, anything for Dr. Rao, anytime you need any help or anything, just give me a call. You've got my personal cell phone number, so please use it anytime you need to.
No, thank you so much, Mayor Rio. So I do have your number, and again, the offer is the same from our side as well. If you feel like we can be helpful in your community, and you have seen all the things that we do here, food banks and other things that we just talked about. Again, we're not hoping for any more disasters to hit, right? So that's not going to happen. So but the offer is same from our side as well. Please feel free to reach out to us, and anything that we can do to help, we will do as well. Again, thank you so much for your time today.
Thank you.
We appreciate you coming on the call today.
Thank you.
Thanks, Mayor.
Bye now.
Bye. So team, we talked about Harvey, right? That's just one example, but our team worked on California wildfires. Archana and team led that effort to put together hygiene kits for the victims of California wildfires, as well as other disasters as well, Katrina, South Carolina. So we could sit here and talk for hours together. So just wanted to highlight some of the things that the team has been doing. So I'll turn it over to Anjani ji. We have one more person to talk to in terms of the impact of VT Seva during Hurricane Harvey. I'm not sure if Ms. Sheetal is on the call, but Anjani ji?
Yeah, thank you, Anand ji. Welcome to the call, Sheetal ji. Yeah, she's one of the beneficiaries of the Hurricane Harvey results efforts. I would like to know from you, Sheetal, as to what was the situation in your area and at your house when the hurricane hit.
First of all, I would like to thank all of the VT Seva volunteers and thank you for having me here. I will explain my experience and my community's experience. As it was just mentioned, we were caught off guard. We were not even under mandatory evacuation, and I know many of us in Houston were like that. We just moved into a new community. Our whole community was flooded. In fact, Harvey hit us on Friday. My house, it was a new house, final paint work was done on Thursday. And we were so sure because when we got the house, we were told that this is such a safe community. It will never be flooded. 90% of the people in my community did not have a flood insurance. And since I said most of the houses were new, people had moved in with new furniture and no flood insurance at that time. It just hit, we were new to US as well. It hit us like a shock. I didn't even knew that the walls will melt like this when water will touch them. We were caught so off guard that no one had time to leave. We evacuated at 1 a.m. by boats. Water came in so fast. Our whole community was like a bathtub because yes, we were surrounded by levee. Water did not come in from the levee. Water came in from the street side and the other sides. And since we were surrounded by levee, there was no way to push it out. The pumps just failed on us. It was a tough time, but as we were all recovering from that, we saw that VT Seva came forward. even after 5 days, we needed a boat to come back and look at our houses. This was the situation. Why we couldn't leave, the water had sewage water mixed with it, and there were like ants all over. You couldn't step into that water, dead cat. And at that time, BT Seva came in, and we were supplied with cleaning supplies and food and help. One of the major concerns was demolition, because if demolition is not done on time, all these houses, the whole community would be having mold in the houses. So people came forward for helping with that. Yes, when we left in boats. So the whole community, the cars were flooded. They were on the street. We needed, I think it took 15 days for the cars to be towed one by one because the trucks couldn't move in. The top of the cars had scratches because the boats moved over them. It was like experience which I think which was a learning experience, a most humbling experience. It changed many of us. I mean, I became a changed person after that, and VT Seva did a lot of work during that time. It was really helpful emotionally as well. At that time, when you can't go in and out of your own colony just because you can't drive, it's all blocked. They walked on foot with food and supplies and fresh water.
Oh. Yeah, it was amazing. You know, you told it in a lot of detail, and I haven't heard like the whole situation as such so much in detail. So thank you for sharing that. And so VT Seva volunteers, what like did you know of any other services they did in the area?
Yes, first of the thing, there was like groups organized demolition. They would come to houses and help with so cabinets and everything was to be demolished. People like us who didn't knew how to do that. Yes, there were other groups as well, churches, and VT Seva had put up stalls in our community, and they would just, so anybody needs help with anything can walk up to them. But they, as I said, we didn't have to walk up to them. They walked to us to deliver what we needed, us going house to house and asking if you need something.
Yeah, thank you for sharing that, Sheetalji. It was very nice talking to you.
Thank you so much.
Sheetalji. Again, like you said, you know, it has definitely, you know, the experience, you know, looks like it was a shock and changed you, and it has definitely changed us as well. And you know, our volunteers are you know, learned more, as well as you know, I'm glad they jumped in and helped. So we appreciate your time.
Thank you so much. And I would like to add one thing that I really, it had a huge impact. And I really felt that the Indian community, we were new at that time, is not just migrants, but contributors and a part of the American society. And it looked like we are all one at that time, because everyone was helping every house in the community. Our whole community was flooded. So it's not just us, it was everyone was being helped.
Yeah.
That was amazing.
No, thank you, Sheetalji. Definitely, you know, when adversity hits, we are all one for sure. And, you know, it doesn't matter what race or origin you are, you know, we all come together, and that's what separates us from, you know, other creatures. So thank you for sharing your story. We appreciate your time today.
And not only in US, but we provided like disaster relief in around the world, like Kerala floods, Chennai floods, and VT Seva and Nepal earthquake relief. So our VT Seva founders and CEO Sri Chinnajiya Swamiji was awarded Uttama Nagarik Sanman from Nepal government in recognition of our services there. Yeah, you can take your word, Anandji.
No, thank you, Anjani ji. Sorry, I'm still stuck at what Sheetalji was mentioning, and so the let's move on to, you know, few other things. I know all of you have been waiting patiently. We're almost there, I promise. There's a couple of other, very, very inspiring stories, we need to talk about, and hope, you will get inspired as well. And especially this section, I'm truly blessed to be talking to these folks. One of the pillar that we talked about is the cancer awareness and prevention. I had mentioned to you about this area is very, close to my heart. And we have a person that was a force behind uh, doing something that really made a big change. Harinder ji from the Seattle area is here. Like I said, he was the force behind getting a mobile medical van for our Indian team that takes care of cancer awareness and prevention. And you might think, okay, what's the big deal about a mobile van, right? So it is a big deal. Number one, our health team goes to these remote villages, and if you know about India, unfortunately, it's extremely, extremely difficult to reach these remote areas. And so having a van really, really helps. And wherever you go, you're doing screening, right? So if you're basically screening women and others, you need privacy. And if you're doing in a school or other areas, there was not much of a privacy. And here, having a bus actually helped in terms of privacy as well. And all the equipment that's needed to be needed for screening and doing cancer awareness and prevention, all of that was inside the bus as well. So it made a huge impact. And like I said, Harinder ji was the force behind getting that to our healthcare team. And I can't emphasize how much important it is to find cancer early and detect it early, so that screening was important, and I'm pretty sure it saved a lot of lives. So with that, Harinder ji, are you on the call?
Yes, I am. Good morning.
Hi, thank you so much for joining us. Again, it's a pleasure to talk with you. I'm truly blessed to be able to talk with you. So, why do what motivates you to donate in general? I'm just curious to find that out from you.
Sure. Well, first of all, I want to say thank you to all the volunteers and frontline heroes. They're true heroes. What I do, my wife and I do, is nowhere near what you guys do. It's a great job. Keep doing it. So Kiran ji, I'd say, is I've known him for 10 years. He is an inspiration for us. So that I think you mentioned, Raji, is that in Netra Vidyalaya, one of the students said that he doesn't want sympathy.
Mhm.
So I'm going to 3 words is generosity, compassion, and empathy.
Mhm.
When I met with Kiran ji, I saw all 3 in him, and he's a big
Right.
role.
Yeah.
So whatever we can do as a human, we have a responsibility and social responsibility to share whatever we have, whether it's money or whether it's time or even smile, that can make a difference. And
Right.
do it all. So actually, I'm envy of you. One day would like to do that too. I don't share my time as much. But,
Right. No, thank you again. We are blessed to have a leader like Kiranji as well, and I'm glad he actually knows you and connected with you, and we are fortunate that you are you saw VT Seva as an organization that you could rely on. But why VT Seva? Why did you pick VT Seva versus
so VT Seva has 4 pillars we believe in, all 4.
Mhm.
Then we look at the volunteers like Kiranji and you guys. You put all of your time. You're not being paid, so that really is the reason. And then doing and the growing and whether it's the students like Netra Vidyalaya, or those poor kids and then rural camps and women health, even in US, what you guys do is amazing. VT Seva is one of the one we donate to, but definitely it's one of the top one.
No, thank you, Harinder ji. We appreciate your support, and again, from our side, we'll continue to deliver with support like folks from you. So we appreciate your time today. Again, like I said, you're definitely truly an inspiring person for all of us. Anjani ji, I know we have one more person to talk to with an amazing story as well.
Yeah. Yes, Anandji, we have another individual, Kiran Simhadri ji from Minnesota, from Minneapolis. Welcome, Kiran ji. Are you on the call? Vamsi ji, I think he's.
Kiran ji, are you able to? Are you on mute? If you are, please unmute yourself. Are you on the call?
Hello, this is Vamsi.
Yeah, hello,
No,
Anand. Hello.
I think Vamsi from Minneapolis. I think that's what they're looking for. Yeah, Kiran ji, he joined the call. Let me check with him.
Okay. Now, while you're checking again,
Yeah.
Please continue to check again. We have a couple of quotes here. It's don't just think about giving as just a donation, right? It's the difference. And you have heard multiple stories throughout the day today about, at the outside, it might seem like something small. Okay, it's only 10,000. What's the big deal? It's only, opening the doors for the visually challenged. It's only, giving that 1 hour of service at a food bank. Again, it's not an only a small thing. All of those things make a difference, and it makes a huge difference. So I implore all of you to continue to do that. So Vamsi ji, are we able to get Kiran ji on the call?
Not yet. I just texted him. I'm not sure. Like he was on the call. Like I think he got dropped.
No, I'm sure everybody is busy. Please continue. We would love to talk to him. Please continue to try to get him on the call. But we'll come back to him if he's on the call.
Okay, sure.
Please let us know. We'll continue with the few more items we need to cover. Again, folks, I promise we are almost at the end. I know it's been a long day, but we're almost there. So please hang on. So please, if we can get him, we'll come back to that. But Anjani ji, you want to cover? Yeah.
Yes, I would like to continue. Yeah, we were not able to cover many of the additional activities which VT Seva is involved in. Our San Antonio chapter, like we've done a lot of work of raising awareness and holding camps for suicide prevention, obesity issues, dental hygiene, and other things. And we have adopted up to around 35 plus streets in US so far. And while volunteering at like a disabled kids camps, our youth had a first-hand experience of working with those kids, helping them, feeding them, playing with them, and taking them out on a walk. And most of our branches, the kids go to senior center visits, homeless shelters, and many, many more activities.
Yeah, again, we could sit here and talk for hours, but we want to keep it short and simple and focus. And hopefully, you're getting the idea around the kind of impact VT Seva has, and how you can join and continue to help us and help to make that difference. So let's check in one more time with Vamsi ji to see if Kiran ji was able to join.
Yeah, he's trying to connect back again.
Okay.
Yeah.
No, that's fine. So we'll wait. It's important. Yeah. So thank you. Again, let's just wait for a minute or two and see if Kiranji can join. While we wait, I know we talked a lot. It was lot of discussion and good conversations. Does folks have any questions? We can probably take questions at this time while we wait for Kiranji. Anybody has any questions or even any comments they want to make? I think are welcome to do so. Please unmute yourself and ask a question or make a comment.
I'm on the call here. This is Kiran. Sorry.
Hi, Kiranji. No, that's okay. It's, we live in a technology world, and it's not always simple as we think. So, Anjani ji, please go
Yeah,
ahead.
welcome to the call, Kiranji. We would just like to know from you, like, what is your motivation to donate and help less fortunate folks than us?
Well, that's exactly it. Right. So, a few of us are, as you know, are blessed in a lot of different ways, and we've been afforded opportunities that other people don't have. So I think, it's just behooves us, and it's part of our duty to do something for people who have less than us. So that's just it. There doesn't need to be a stronger motivation than just that.
Yeah, and we've heard from Vamsiji that you're one of the biggest supporter of VT Seva Minneapolis and encourage them in all their activities. So we would like to thank you for your generosity towards VT Seva. And the other thing we wanted to know is, like, why did you choose VT Seva above all the other organizations?
A good question. I think, just listening through some of the presentations today, the impact that VT Seva has on the issues that matter to the day. I think whether it's disaster relief or COVID, in addition to supporting the children with disabilities and stuff, which has been long pending issue for a lot of foundations and stuff too. I think that's pretty heartening to see that it has a direct impact on the issues that matter to the day, but also to where the need is. And I can see that it is a clear line of sight. So appreciate you guys doing extraordinary work in keeping it front and center, keeping the main thing front and center. So I think that's what makes VT Seva different than the others, is the direct impact to the society without a lot of middle tiers and hierarchical structures.
That's true, exactly. We have like very less administrative cost, and whatever you donate directly goes to the cause.
Yeah, and we can see that very clearly. So appreciate all your hard work and commitment towards the cause here.
Yeah, thank you so much.
Thank you so much, Kiranji. We appreciate your support, and we look forward to working with you more. So
Absolutely. Thank you.
So team, we talked about a lot, right? I mean, we talked about a lot today, but remember, some of the things that I remember, and I'm sure, some of you on the call would remember, when Dr. Chekilam talked about, Andover and what she has seen there, and how, having those masks helped, to actually see patients, right, and make a difference. And we talked to multiple folks, during Hurricane Harvey. We heard from Mayor as well as Sheetalji on, the impact that VT Seva had, as well as, from food banks, right? And we heard from Ali about, the people that are looking at labels to figure out, okay, is this something that my kid can take because they're allergic to the food, and how it saved their life. So there's so many stories, throughout that we heard, and I truly hope all of you are inspired and motivated to do more. I'm definitely energized even more to do better. But the bottom line is, everything needs funds, right? Everything that we want to do requires funds. And we talked earlier about the supply and demand thing, right? So in the COVID world, typically by this time, we are able to raise funds. We are able to say, okay, we're good. We have all the funds we need to do our work, and we were able to go out, do all the activities. The need of the funds is actually higher during this time because of the COVID, and just not here, but also in India, because there's a lot of logistics around reaching out to these people, and it just requires a lot more funds. So on one side, the need has increased, and on the other side, the supply and the funds we raised this year actually has decreased. So the gap has increased between what we need and what we raise. So the biggest thing we have to do for the rest of the year is to make sure we meet our goals for fundraising in 2020. And again, I can't stress enough to make sure everybody, please, roll up your sleeves, reach out to as many people as you can, and try to get that funds, because every single thing we do requires funds, right? Again, the world runs on green, right? The other piece is, try to involve as many new volunteers and donors. Again, we heard earlier, a lot of them are donating to us because of the relationships people have made, right? Harinder ji knows Kiranji, and he takes the word of Kiranji and donates, and we are able to make an impact with that, with the bus and so forth. So make that connections, and remember why we are doing this, right? So we are doing this to ensure that we increase the tolerance and understanding in the society, and we're doing that through the youth. And you have seen that 2,000 volunteers out of the 3,500 are youth. And professor talked about changing them, right? I mean, it's the time to inculcate that values in them, and the value of volunteering, and he stressed the importance of it, so that ultimately we change the life of the children who are impoverished and underprivileged, to make change in their life so they can live independently and a life of dignity and pride. So I want to thank everyone here. I just want to turn it over to Anjani ji for an important announcement. So please stay tuned.
Yeah. Next month, December 6th, is the concluding session for our Meet the Beneficiary series. And it's going to be an amazing session where we'll be meeting our CEO and founder, His Holiness Sri Chinnaji Swami. Swamiji will be talking about his vision and roadmap for VT Seva. You have a question to ask this?
I'm on a call.
Yeah, please go to tinyurl.com/askvtseva.ceo. Thank you. Thank you all.
Thanks, Anjani ji. Again, the URL is tinyurl.com, ask VT Seva CEO. We truly appreciate you, taking 1.5 hours of your valuable time and joining us. Hope you were inspired to do more, and let's do it together. Thank you so much, and have a great day. Bye, everyone.
Thank you. Have a nice weekend. Bye.
Have a good weekend.